Welcome to Admission Straight Talk, the podcast dedicated to graduate admissions and helping you approach the application process thoughtfully and successfully. Your host is Accepted's founder and world-renowned admissions guru, Linda Abraham. At Accepted, our mission is to get you to that unforgettable moment when you read your acceptance email and shout, "Yes, I'm in!" Confident you'll be attending the perfect program to help you launch the career of your dreams.
Do you want students you admit to have both research experience and clinical exposure?
So that is an interesting question. I would actually replace research experience with community service experience.
Okay.
And I will tell you, that yes, they need to have community service and clinical exposure, and why, right? So we want students to have clinical exposure so they can appreciate the role of the patient, the physician, members of the interprofessional healthcare team, and how a hospital system works, right? From the community service perspective, that's who we are as an institution. That is vital to the mission of the institution, is to recruit students who are actively engaged in service and part of their community. And I will also mention that work within a healthcare organization and being a provider, you are in service of others. And so having community service and clinical exposure is absolutely aligned with the mission, vision, and values of our institution.
Okay, great.
We would love for our students to have research experience as well. And I talked to you a little bit about the research opportunities within the curriculum. And so there are a lot of opportunities that we do offer students during their time here at our institution to engage in research experiences.
But in terms of incoming students, research is more of a very nice to have, should I say? Whereas the clinical and the community service, or the clinical exposure and community service, really shows that alignment that you're looking for to the core values. Am I interpreting you correctly?
So that is correct. However, I would like to say that as part of the mission, if you look, I like to call them our 4 pillars.
Okay.
One is community service, right? The other one is the ability to utilize evidence-based research.
Okay.
And having a background in research would help along with alignment there as well.
Okay.
So I don't want to say, you don't necessarily have to have it. What I will say is we do have a focus on community service and clinical exposure, but clearly having exposure in research does align with our mission in terms of the evidence-based research.